I'm Tom Swarbrick with you here on LBC. It was referenced quite a lot in the last hour of conversation, and I think at the moment in this country, given the state of the NHS, you just have to hope that you don't get ill. Don't fall over on a pavement and have to go to A&E and wait 9 hours for an x-ray. Don't get admitted with something and get stuck in a bed for days and days because you can't be moved into social care or moved home. And for crying out loud, you better not be unlucky enough to need non-emergency surgery. Even Britain's top A&E doctor is adopting this mantra. Dr. Adrian Boyle, the new president of the Royal College of Emergency Medicine, says he's desperate to keep his elderly parents from going into hospital this winter because hospital crowding and bed blocking were killing hundreds every week. He compares hospitals at the moment to lobster traps. He said the crisis in social care had left 13,000 patients stranded on wards despite them being deemed medically fit to leave. Dr. Ian Higginson is the Vice President of the Royal College of Emergency Medicine. Thank you for coming on the programme, Dr. Ian. Your colleague seems to be describing hospitals as death traps. Is that accurate?
I think that would be an unfair characterisation of what Dr. Boyle was describing. What he was describing was the situation that is faced in many hospitals and what we know about the harms that are associated with overcrowding in our emergency departments and in our hospitals.
How bad is the overcrowding?
So I think for most of us in emergency medicine, we haven't experienced conditions like this for as long as most of us can remember. So in most emergency departments in the country right now, there will be patients in our corridors. There will be patients waiting in ambulances to get into our corridors, and there will be patients at home waiting for ambulances. And I think it's the extent of that queue to get into our departments and the effects it has on the ambulance service that is causing the problems at the moment in our departments.
Hospitals running at 94.3% occupancy, the highest ever. That is obviously before winter has hit. It says here the maximum safe limit at which the doctor-to-patient ratio is manageable is 85%. So are hospitals becoming less safe for patients?
There's no doubt whatsoever that when hospitals get full and that generates long waits for emergency care, that makes it less safe for patients. And there's absolutely clear data that links overcrowding and long waits, which are caused by full hospitals predominantly, with increased numbers of deaths in our patients. And those are the sort of figures that Adrian was describing. But what makes us really, really cross in our speciality is that we have talked about this for years and years and years. This is essentially something that is coming to pass that was absolutely predictable, and we've really not seen the sort of action to fix it in the past that we were recommending, and now we really are reaping the consequences of that poor leadership and poor health policy.
I'll come back to that in just a second, but I'm still very struck by the language that the President of the Royal College of Emergency Medicine is using about hospital. He says, for someone who is frail, hospital is often a bad place for them. They're being harmed by being in hospital. Is there evidence for that? Because I think that is going to scare quite a lot of people.
Well, we know that being in a hospital isn't the best place to be if you don't need hospital treatment. That's for sure. There's a risk of cross-infection. It's an unfamiliar environment. It's much better if you can be looked after in places like care homes or nursing homes or in your own home than being in hospital if you don't need hospital care. If you need hospital treatment, then absolutely the right place to be in is in hospitals. But I think those of us in the NHS are also worrying that we can't provide the sort of care we would like to within hospitals because of the problems we're facing in our organisations at the moment.
Because of the blocking that's going on in moving people who are possibly frail but well out of hospital, that is creating the backlog back into emergency care. That's why ambulances are waiting 12 hours at the doors of hospitals.
That's right, yes. It's essentially a long traffic jam with humans feeling the brunt of it in the middle of it. So we can't, in hospitals, we can't get our patients into the social care sector because of the problems that are being faced in that sector. That means our hospitals are full. If our hospitals are full, our emergency departments get full. And if our emergency departments gets full, we can't get the ambulances in. So they're in our car parks. And if they're in our car parks, the ambulances can't get to patients in the front. So it's a huge traffic jam, but patients are suffering in that traffic jam. And that is the main problem. There are other problems, such as the workforce difficulties that you would have heard about. That's another problem that does face hospitals. They're not only overcrowded, but many of them are really struggling to find the staff that they need. And the final problem is that many staff at the moment are really running on fumes, and that also contributes to the difficulties we're facing.
Would you rather, I mean, it's a horrible position to have to be in, but the harm that someone would come into by being at home when perhaps the care isn't formally set up around that person, versus the harm that that person would be in by staying in hospital when they don't need to, and the effect on everybody else back further in the queue, as it were. Which would you rather? Would you rather the frail person goes home and is cared for in a way in which the hospital can't define because they just aren't there, family have to muck in, everybody else has to help, or keep them in hospital?
What I would rather is that patients who can be treated at home safely are treated at home. The patients who need to come to hospital can get to hospital and can get into those hospitals and be treated in those hospitals. And patients who finish their course of treatment and need to be in social care are in social care. And that's what's not happening at the moment. Everything else becomes a balance of risk, which puts patients and healthcare professionals in an invidious position trying to decide the least worst option. So what I would rather is that we had an efficiently functioning NHS that was properly funded, properly staffed, with a properly geared up social care and primary care system around it, so that we can all do our jobs properly and provide the care that we would like to do.
And you agree with your colleague that this blockage is killing people?
There's no doubt whatsoever that overcrowding in hospitals and overcrowding in emergency departments, so what you call blocking, the phenomenon of overcrowding, is associated with increased numbers of patients dying. And there's no doubt whatsoever that the sort of numbers that Adrian is quoting are well documented in the medical literature. And as I say, we've been warning about this for years, and it's very frustrating for those of us in emergency departments that our expertise and our advice has not really been taken into consideration as part of health policy planning. And now we're seeing this awful situation developing.
So I hear what you're saying, and I think for me and my own family, and perhaps my listeners and their families, it strikes me that what you're saying is do not end up in hospital, do not go to hospital unless you absolutely have to.
No, that's not quite what I'm saying. I think what I'm saying is, what we would say in that circumstance is the health service at the moment is doing its best to provide the services it can for those that are needed to. And there's a lot of healthcare professionals working really hard to point patients in the right direction and to make the right decisions about where they need to be. But if you are sick and you need emergency care, then we are still open. We are still here, and we wouldn't want people sitting at home who need to be in hospital or need to be in our emergency departments. So I wouldn't want to put people off who need emergency care from coming to our departments, because that is what we're here for and that is what we want to do. What I can't do is promise that we can give the standard of care that we would like to, because our departments are full to bursting at the moment. So I would never say to someone, don't come to our departments, but I think it's fair to our patients to let them know that we are really struggling to provide the care that we would like to at the moment, and that we're not always getting the results that we would like to as a result of that.
Do you think finally that part of the solution to some of this, as well as the political choices that are to come later this week when it comes to funding, but some of the solution to this, it strikes me, is in and around technology. If you could send a frail but well person home and have their condition monitored remotely via medical kit that they're wearing or whatever, then at least they could be monitored by somebody without having to be in the hospital.
So, it's always a tendency to jump to technology, but I think that the most important solutions to this lie in proper strategic planning, realistic planning, and proper leadership. And then what we have to do is we have to build the capacity and the workforce to deliver the care that we need to. We can have all the technology in the world, unless we've got the workforce to use that technology, it won't work. And unless we've got a social care system that can actually look after our patients for that technology to be used, it won't work. So I think rather than go straight to technology, I would always go back to the basics. We need investment, we need planning, investment, and we need a workforce.
But it just sounds like we're starting again. The system is so wholly broken. I mean, you and your boss, the president, coming out and saying what you're saying about being in hospitals. This is a fundamental change required across the whole NHS to try and prop this thing up.
Well, there's no doubt that what's happening at the moment is already driving fundamental change in the way that we deliver care. You just need to go into any hospital to see that. And it's, again, as I say, it's really frustrating for us to see ourselves really going backwards when for a time it looks like we had been going forwards, because the health policy decisions have been focusing so much on essentially trying to cut back on beds and try and minimise the workforce and minimise the investment rather than the right strategic planning. So we're really frustrated, angry and upset that we've ended up in this position. And for our poor patients who live it, we really feel for them, and that is really eating away at many staff in emergency departments, because we know we've got these amazing people in our speciality, the doctors, the nurses, the other professionals. We can deliver absolutely fantastic care in this country if we give them the tools to do our job. And I'm afraid the overcrowding and the pressures on our workforce at the moment are stopping us doing our job properly. And that's all we want to do for our patients.
Very good to talk to you. Appreciate your time. Dr. Ian Higginson, Vice President of the Royal College of Emergency Medicine. That is desperate, isn't it? Absolutely desperate. And it sort of makes the point, to be honest, I was making at the start. You've just got to hope that you don't end up going into hospital at the moment, because even the boss of the Royal College of Emergency Medicine is saying hospital overcrowding and bed blocking are killing hundreds every week. Hundreds. 03456060973 comes your calls on that after this. 516